Hi, this is Dr. Jason Kullmann. I'd like to welcome you back to the second installment of this video in regards to Activator Methods. Today we're going to show you a Activator Methods Technique treatment. Today we have Tori with us. She's going to be our volunteer today. So we haven't adjusted Tori for a few weeks, so we're anxious to find out if she has any of those misalignments, those subluxations that may be causing some nerve interference and possibly causing her pain up in her upper back and neck. So if you haven't seen that first video, go ahead and take a look at that. That will explain a lot about what we're about to do. So right now, let's get Tori down on the table, especially with people with acute lower back pain. It's often difficult for them to get up and down on the table. We have an automatic table that makes that a lot more comfortable, especially on our geriatric patients. So here we go. Okay, like we mentioned before, we're going to use the Activator Methods protocol in order to adjust Tori. And again, we're using the Activator Methods protocol because it's so safe and effective on the patient. Now, the importance of the Activator Methods technique is the procedures that we use to identify subluxations in the patient's back. So we're going to take you through these series of isolation tests. A lot of this work was done over at Arizona State University. It's highly researched, and again, we get excellent results with it. So in the treatment protocol, we always start from the legs and work our way up the back. So we'll mention a few things as we go along, but we utilize leg length reactivity in order for us to make sure that we're adjusting the right areas. So we notice on Tori that she has what we call a pelvic deficient side on the right pelvis, and we're just going to confirm that that pelvis is out of alignment. And when we pressure test or force the joint into a normal direction and it balances out the leg lengths through a series of neurological reflexes, we know we're on the right spot. So we're going to utilize the Activator 5 instrument to make our adjustments. The first one is we're going to adjust her pelvis. And we're going to adjust her pelvis forward utilizing the Activator instrument. And we use the force setting that's appropriate for her back. So if the adjustment was good, if the adjustment was effective, it should balance out the leg lengths and she should be doing okay. Put your right hand up on your lower back for me, Tori. Right hand down, left hand up on your lower back. Put both hands up on your lower back. Great, both hands back to your side, right hand above your head. So as we have her do these different arm motions and head motions, we're engaging different muscle groups that attach in different parts of the spine. If we get a reaction, if the joint is not functioning properly, it's not moving properly, corrupted nerve impulses will be sent to the brain. The brain tries to sort that out by relaxing and contracting different muscle groups throughout the body. That's what gives this appearance in what we call leg length discrepancy or relative leg length discrepancy. Left hand above your head also. Now we know Tori's got a few mid-back problems, and so now we're up in her mid-back and there is a change in the leg lengths. That's an indicator for us that neurologically upper at her 8th thoracic vertebra, that's not functioning very well. Put both hands back to your side. So we're going to go ahead and adjust the 8th thoracic vertebra. A little sore in there, Tori?
Yeah.
Put both hands above your head for me. Great. You balanced out nicely. Put both hands back to your side. Turn your head to the right. Lift your right shoulder up off the table and back down. Turn your head back to the center. So what we just did is a test a little bit higher on her mid-back, and that's the 4th thoracic vertebra. We're going to adjust that because we found one of those misalignments that are causing nerve interference in her spine. So we're going to go ahead and adjust that, and that might even be a little tender also. Is that correct, Tori?
Yes.
Usually we like to have the patient's face down because it muffles the screams of the patient. Just joking. All right, turn your head to the right. Let's see how we did, Tori. Lift your right shoulder up off the table, back down. Let's have you shrug your shoulders up towards your ears. Roll your shoulders backwards. Turn your head back to the center. Let's do a couple more tests on you. Turn your head to the right again for me, Tori. Let's have you squeeze your right elbow into your body and relax. Squeeze your left elbow into your body and relax. Shrug your shoulders up towards your ears and relax. Roll your shoulders backwards for me. Big circle and relax. That looks fantastic. Turn your head back to the center. Lift your chin up, back down. All right, so Tori gets a reaction here to her fifth cervical vertebra. So we're going to go ahead and adjust that. And this time we're going to use a lower force setting on her so it's comfortable. And obviously she doesn't have a lot of tissue back here, so we don't need to use as much force to get the same reaction, that neurological reaction that we're looking for. All right, lift your chin up again for me, Tori, and back down. Tuck your chin to your chest and relax. That looks fantastic. Now, besides the Activator Methods protocol that we use to find those areas of subluxation, we're going to use some tissue palpation, obviously, range of motion studies, orthopedic examination to locate those areas of misalignment with our patients. But that's just a quick reference to the Activator adjustment procedure. Again, this is Dr. Jason Kullmann, yours in health. We'll talk to you soon.